प्रेगनेंसी के दौरान आपके बॉडी में काफ़ी हार्मोनल चेंजेस होते हैं और ये जो आपका थायराइड है इन हार्मोनल चेंजेस में काफ़ी बड़ा रोल प्ले करता है। वेदर बी इट हाइपोथायरॉयडिज्म और हाइपरथायरॉयडिज्म, ये दोनों ही आपके प्रेगनेंसी को और आपके बेबी को भी अफेक्ट कर सकते हैं। सो इफ़ यू आर अ मॉम टू बी या फिर अगर आप प्रेगनेंसी प्लान कर रहे हो, सो दिस एपिसोड इज डेफिनेटली फॉर यू। So, namaste and welcome everyone to another episode of Beyond the Pill, where health meets conversation. I am your host, Dr. Chetna, and in today's episode, we will be talking about thyroid and how does it impact pregnancy. So, to decode everything and make us understand this better, joining us today is Dr. Debarati Bhar. She is a highly regarded endocrinologist practicing in Kolkata with rich years of experience in the field of endocrinology and internal medicine. Dr. Bhar is also known for her expertise in managing variety of endocrine disorders with special focus on diabetes, women's health, and endocrinology in children. So, firstly, good morning, ma'am. And thank you so much for giving your precious time to our show today, which is Beyond the Pill, and also helping us spread this awareness about all the endocrinology related disorders. So, very firstly, let's start with your journey as becoming an endocrinologist.
Good morning, I am Dr. Debarati Bhar. I am an endocrinologist in Kolkata. I've always believed in the treatment of patients to be the foremost goal of my life. And when I entered medicine, I decided that hormones are a very crucial thing to maintain our body homeostasis and also to do the various emotional changes which bring about the changes in the body physics, the developmental process from the mother's womb right up to childhood, puberty, and then the adult life. And then I decided to enter endocrinology to follow and explore all these different perspectives. And I learned so much new things which I never learned when I was in medicine. So I was always interested in the field and its new advances. And endocrinology is a subject which advances by leaps and bounds. So many new discoveries, many medicines in the field of diabetes come first to us. So I'm very happy to be in this field.
So, ma'am, our today's topic is about thyroid and pregnancy. So this is like a topic which has been not spoken about, and there is very less awareness about this topic. So I'm very grateful to you that today you are here to talk on the same. So just to start with the basics, I want to understand that what exactly thyroid as a hormone has a role to play, especially in pregnant women.
You see that the thyroid gland develops not very early in fetal life. So the entire thing which is essential for our body develops little late. So what we need is the mother. The mother has to support the entire fetus during its initial stages of development until the thyroid gland of the fetus itself becomes active to take part in its own activity. As we know, thyroid gland is a hormone which maintains our basal metabolic needs. Suppose you're sitting here, we are talking here, we are moving about, leisurely walking. All these needs the basic function of the body, and its basic function maintenance is a basic form of energy. And that energy, is supplied when how much energy is to supplied, how much energy is less supplied. All this determined by the thyroxine hormone, which is being supplied by thyroid gland. However, in the fetal life, when the baby is in the mother's womb, what happens is that all these stages are in the stages of initial development. So during the initial development, what happens? The brain has to develop, the spinal cord has to develop, various nerves in the body has to develop. And all this neural development also is very crucial for the fetus to develop into a normal baby. And for that thing, the thyroid hormone is absolutely necessary.
Okay, so from this we understand that thyroid has a very crucial role to play even for the baby's development, not only for the pregnant woman. Okay, so also now there are types of thyroid which we know commonly, which is hypothyroidism and hyperthyroidism. So is it that pregnant women can have only either of it? I mean, is it how common is having hypothyroidism in a pregnant woman?
Well, see, there are two types of thyroid disease which happens in people, even in pregnant as well as non-pregnant people. So these are the underactive thyroid or hypothyroidism and the overactive thyroid or hyperthyroidism. Now, basically, hyperthyroid state runs a little bit during pregnancy, which is normal for the mother and not harmful for the baby. So mild degree of thyroid overactivity is normal. and we should not treat it. However, when hypothyroidism, underactive thyroid develops in the mother, it definitely hampers the baby because most of the thyroxine which is produced in the mother cannot pass through the baby because of the presence of the placenta. The placenta destroys most of the thyroxine hormone. Little bit of it passes through the baby and takes care of its neural development and the brain development, as I talked about. So when thyroxine is in reduced synthesis, the less amount of thyroxine is being produced of the mother and more of it is destroyed by the placenta. So less and less of it enters the baby. So whenever if a mother is hypothyroid, the baby is bound to suffer. So you must treat hypothyroidism in pregnancy. And it's very common. It's so common that nowadays all pregnant mothers are undergoing universal screening.
Okay. So when do this screening usually starts, in which
Whenever you are detected pregnancy, that is the first time your gynecologist should advise it. If the patient is already known to be hypothyroid, suppose patient is under our care and being transferred to a gynecologist during the pregnancy visit, I tell them, or we all tell them, that you must test your thyroid function once you know that you are pregnant. Because what happens is that suppose you are on a medication like thyroxine in a dose of say 50 microgram and that is continuing throughout your life. Suddenly you become pregnant. That is the time when your body needs more and more of thyroxine to supply both the mother and the baby.
Okay.
But at this time, if you continue to do the same dose which you were taking before pregnancy, baby and mother both suffer from hypoactive thyroid and that causes further damage. So for this purpose, you need to increase the dose and you need to visit your gynecologist, your endocrinologist, and need to test it very frequently. And very frequently, I mean is every month. At least once a month checkup after the first checkup is very important. And then that way you can easily manage it.
Okay. So there are like two scenarios. One scenario is that the mother already knows that she is having thyroid, so she has to continue with the dosage. But then also in the other scenario where the mother is not been detected with thyroid earlier and after pregnancy or during the pregnancy suddenly, what are the symptoms that she would notice and then she would understand that this might be thyroid?
The sad thing is that most mothers don't notice anything. Even most patients who are hypothyroid in the earlier stages, even when they're not pregnant, the symptoms are not very much frank. You may have constipation, you have swelling of the legs, you have the weakness, lethargy, but they develop only when the disease is advanced.
Okay.
But in the early stages, almost no symptoms are present. And in this case, it's dangerous for the mother because the mother is itself unaware, as we just said. And universal screening, if it is not done, the disease is not detected. And as the stage advances, a little bit of rise in TSH causes great damage to the baby because baby is suffering from underactive thyroid because it's not getting the thyroxine from the mother.
So what could be the reasons of developing a thyroid for a pregnant woman especially?
Most cases of thyroid disease in pregnant women is because of an autoimmune disorder which is called Hashimoto's thyroiditis. And that thyroiditis is very common even in the non-pregnant population, and because of pregnancy, as I told you, a little bit of rise in thyroid disease can cause a great harm to the baby. So even if the patient is not having this autoimmune disease, it can still be a case of non-autoimmune hypothyroidism, but still we need to treat it. The other causes of thyroid disorder, which was say very common in the previous times in the world, was iodine deficiency. Now, as you know, iodine deficiency has been easily tackled by universal iodization of salt. And as a result of which, almost iodine deficiency disorders causing goiter and hypothyroidism or underactive thyroid in pregnant mothers have almost disappeared from the world, even in the underdeveloped areas, because of the availability of iodine in salt so easily. So the most common would be Hashimoto's or autoimmune thyroiditis in the mother, which causes hypothyroid in both the mother and the baby. Now, if you are talking about the baby only, there are certain causes like say iodine deficiency, if there is present in the mother, can cause iodine deficiency in the baby resulting in hypothyroidism. Even Hashimoto's thyroiditis in the mother can cause hyperthyroidism in the baby, and we call this entire group as congenital hypothyroidism. Per se does not pass on like that, but yes, there are certain hereditary genes involved, but it has been seen that congenital hypothyroidism is common in a baby whose mother was hypothyroid. It is possible, but mostly it is the deficiency of the thyroid hormone because Hashimoto's thyroiditis which causes the baby to develop hypothyroid. So it being an autoimmune disorder, it does not signify that this is a hereditary disorder. But yes, certain genes are there which can be transmitted. Yes.
So in that case, once the baby is born, you need to test for thyroid.
Any mother who is hypothyroid, and nowadays because of the universal screening protocol, any baby who has been born is routinely tested for hypothyroidism, because we know that this disease is easily treatable by using a simple tablet.
Okay.
And this tablet cures the entire thing.
Understood.
So why not test them?
So there are some people who have this mental block that medication, thyroid medication during pregnancy can have some side effects on the fetus as well.
Yes, that is a true thing, but it's actually basically a myth.
Yeah.
Because thyroxine is a hormone which is being supplied in tablet form, the hormone which is essential to our body, more essential during pregnancy, more essential to the fetus as well, and the newborn baby. So it is actually a boon, a benefit, a blessing coming in the form of a tablet.
Okay.
It is not at all any bad thing to think of.
Okay. So the alteration in the dosages should be prescribed by the doctors, and the pregnant woman or any patient would not just randomly start taking it, just because it's a beneficial thing.
It's basically very difficult for the patient himself or herself to decide on the dosage of thyroxine, just as it is difficult for them to decide for a dose of pressure medicine or sugar medicine. Similarly, the thing has to be started by a doctor. And nowadays there are various platforms like social medias and all. You can communicate with the doctor. There are apps are available, and you can, if you're not able to come to the chamber, a direct visit, you can connect and you can increase the dose.
Okay.
It's widely available.
Okay. So this was like the pregnancy journey of a woman who have thyroid, but then there is a big social stigma going on, the relation between thyroid and infertility. So does thyroid cause infertility?
Yes, it does. It is not a myth, it's a true thing. And infertility patients are often tested initially for the initial screening factor, and thyroid test is one of those. You need to treat hypothyroidism, because what happens is that when there is hypothyroidism, which is overt or frank, it is causing a difficulty in the ovum or your egg to mature. And this results in the difficulty in ovulation. Or even after the baby has been implanted in your uterus or womb, what happens is that it cannot progress to the entire last period or last terms of pregnancy because of the presence of underlying hypothyroidism. Okay. So miscarriages, abortions are also frequent. Okay. In that respect, you should get it tested before even pregnancy. If you're planning pregnancy or you're undergoing any ART, that is an artificial reproductive technology treatment for infertility.
Okay. But then it's not that कि अगर thyroid है तो बेबी होने के चांसेस बिल्कुल ही नहीं है.
बिल्कुल नहीं है, that is not the thing, but there are chances are being less. So if you want to be pregnant, you have to optimize everything in your body to become normalized. So why not the thyroid also? Even if there is slight rise in TSH, which is called subclinical hypothyroidism, the patient is asymptomatic, no symptoms are there. Even then we tell the patients that you should get your thyroid tested. If it is slightly high, under the care of an endocrinologist, you first treat it, normalize it, and then you go for the artificial reproductive technology if you want to.
So because of this less awareness, there are families who just doesn't accept the woman because she's got thyroid, and with this myth in their head that she won't be able to conceive. So what is that? Because now I feel that the science has developed so much that everything is possible in today's world.
There are several myths in Indian society. Many of them are based on age-old superstitions, and this what you talked about is just one of them. Okay. So that can only be overcome by increasing the social awareness programs like this we are doing now.
Yes, ma'am.
So that is the only way to go out.
So when it comes to infertility part of it, if any woman who thinks that now I want to conceive, so before planning, do they need to visit their doctor? Like, is it mandatory to visit the doctor and get the dosages set?
Yes, it is mandatory. Unless you test yourself, you don't know whether you're actually hypothyroid or not. If you're hypothyroid, even if a small bit of it is there, it's called subclinical hypothyroidism. Then also you need to treat yourself before you become pregnant or even plan on those.
And how common are the abortions in women with thyroid?
There is data are
miscarriages.
There. Yes, miscarriages are there. We cannot act there. There is the direct causality relation. If you say that is less. But if you are hypothyroid, there are other factors and they culminate together to develop abortion. The rate will be around, say, 5 to 10%. So in that case, if you don't treat one factor, how can you say the other factor was responsible for abortion, spontaneous abortion? So in that case, we need to treat everything holistically, and thyroid should be included in that.
Okay. So now coming to the management part of it, how much does diet or lifestyle changes play a role?
Yes. Basically, diet or lifestyle changes do not affect your thyroid disease. But the thing is, people usually become overweight. And when they become overweight because of the excess eating and they're spending less and less calories, so thyroid disease worsens. So if you're slightly high on the TSH, people think that you need thyroxine treatment, but that is not a true thing to do. The better thing is to lose your body weight. When you lose the body weight by active physical exercises, say you walk, brisk walking for at least 30 minutes for 7 or 6 days of the week, you eat choose your calories judiciously. For example, you take more of green vegetables, you take less of the junk food. In that way, your calories come down, your body weight comes down, automatically your thyroid function also improves. And you don't need thyroxine therapy for each and every case of
Okay.
those obese people.
Okay.
Now, if you're developing frank hypothyroidism, as I told you, there are cough pain, there is swelling in the body, there is facial swelling, leg swelling, severe constipation, lethargy, and you got tested and you see that hypothyroidism is there, you need to treat it. But side by side, you also need to maintain your body weight. And regarding food, the most important thing to remember is that after taking a thyroid medication, it should be the first thing in the morning. Then you space out by at least 1 hour. Then you take additional extra food or water, whatever you want, so that the absorption of the medicine is good.
Okay. So any specific dietary recommendation for a pregnant woman with thyroid?
There is as such no specific recommendations because, as I told you, because of the universal iodization of salt, the extra iodine requirement during pregnancy is already met with the salt which you take in everyday food. So another thing, thyroid medication, as I told you, they should be taken first thing in the morning, 1 hour gap to be maintained. But regarding pregnancy, we have to take iron and calcium tablets during pregnancy. So in that case, the thyroid medicine and these iron or calcium tablets should be spaced out by at least 4 hours.
Okay.
Because that will not hamper the absorption of the thyroxine.
So just one question is which I have in my mind right now is that women lately doesn't have a very good lifestyle going on. Like there's a lot of alcohol consumption, there's smoking before marriages or before pregnancy as well. So can such bad lifestyle lead to development of this thyroid disorder during pregnancies?
Usually it doesn't. Alcohol or smoking, that is not related to hypothyroidism. Hypothyroidism, as I told you, is most commonly due to autoimmune disease, Hashimoto's disease. That thing develops on its own.
Okay.
But smoking, alcoholism, these are addictions. They are going on in the society. You cannot stop them.
Okay.
And the thing, if I say that you should not smoke, it's like a gender discrimination. So why should I say this? If you do not want to smoke, your ladies do not ask the gentlemen also to smoke. Similarly with alcohol. You stop your alcohol at your home, you stop it, then your children will not take alcohol by seeing you. And then it will go on down the generation. Nowadays, it's just a formal habit. You go to parties, you drink alcohol. So how can you stop that? The society is changing. You have to accept that.
And then how prevalent is hyperthyroidism in a pregnant woman?
Hyperthyroidism, as I already told you, is a more common natural thing which happens during pregnancy. And this mild degree of hyperthyroidism, which is sometimes called gestational toxicosis, that thing actually happens slightly beneficial way because the extra thyroxine is supplied from the mother to the baby. And pregnancy, as you all know, when gradually the pregnancy advances from first to second trimester onward, we get certain degrees of palpitation, some breathlessness, some overweight feeling, and even thyrotoxicosis in initial stages, there is certain degree of palpitation, tremulousness. So they almost balance each other. So it is very difficult to separate the two symptoms. But if you are having, say, a disease like Graves' disease, which is a cause of hyperthyroidism in pregnancy, this disease actually improves during pregnancy because the autoimmune concept of Graves' disease comes down as thyroid disease progresses during the pregnancy because of the beneficial effects of the placenta. So you are expected to not develop a thyrotoxic disease in pregnancy. If it at all develops, very little medicine is required. Mostly you need to visit the endocrinologist, you need to have your patient reassured, counseled properly. If there is severe symptoms of palpitation, you can start a medicine like a beta blocker, and antithyroid drugs may be required, but in the minimal doses possible, because we must remember that once we are treating the mother, we are also treating the baby at the same time. And the doses are completely different for the mother versus the baby. So once you start hyperthyroid or overactive thyroid treatment in the mother, the baby is always being treated with an excess dosage, and the baby's thyroid is becoming smaller. It is becoming underactive.
Yes.
The baby is developing huge goiter at the risk
Understood.
of treating the mother. And
Understood.
these babies after birth, will develop hypothyroidism. So that is another danger.
Okay, understood. So in all, be it be hyperthyroidism or hypothyroidism, it can be easily managed by taking your medicine or medication on time.
Yes.
So just like a second last question, that what are the common myths or misconception which is going across, that you come across when you see the patients?
The most common misconception, as you already discussed, is that they say, doctor, I'm already pregnant, should I stop the thyroxine? Or they stop the thyroxine once they were already on thyroxine and they come and say that I have become pregnant, so I've stopped it. That should never be done. If you want to treat your baby as well as your mother, you please ask the patient to continue the medicine without missing even a single dose. Second thing is about the tests. They say that why should I get tested so frequently? The thyroid function changes drastically, and it so much changes during pregnancy. Unless you do a monthly monitoring every 4 weeks, it is very difficult to understand what changes are occurring in your body. So that is a myth. You should tell them that this is not for the mother only, for the baby also. You need to test very frequently.
So even after giving the birth, how frequently the mother needs to get a thyroid level check?
After birth, it is also, you must be, that is not so much of an emergency. We ask the mother to reduce the thyroxine dosage by around, say, 20 to 30%. Some patients half their dose, that is also not an issue. You come back after 6 to 8 weeks. When you're scheduled for your first postnatal checkup, there is no emergency. You come to visit the gynecologist, same time you visit your endocrinologist.
Okay. So any important message that you want to give to our viewers?
Yes. So as we have already discussed, please understand that thyroid disorders are very simple, easy to treat, but if you don't treat, they have some fatal, drastic consequences. So please regularly visit your endocrinologist, your gynecologist, and keep monitoring your disease regularly, and please dispel all the myths associated with the disorder. This is not a fearful scenario to be afraid about. Just go about with a doctor, discuss with them, and please adhere to your treatment. Thank you.
And also, like a very last question and very important question, I feel that I think we left. We have not spoken about what would happen if this thyroid goes untreated.
Oh, yes, if the thyroid disease is untreated in pregnancy, the baby will progress to develop hypothyroidism. As a result of hypothyroidism, the baby's brain won't be developed, so there will be severe degree of mental restriction or retardation, and baby will be developed into a patient who is severely underdeveloped IQ. And that baby will remain, like that throughout their life. Growth also will be hampered. The baby will have underweight, baby will be developed. Then after birth, there will be certain degree of umbilical hernias which will develop. And this type of thing, baby may undergo severe hypothermia, or they could cold shock because of the deficiency of thyroid hormone in the body.
Understood.
And as I said about the hyperthyroidism, if you overtreat the mother, the baby will develop a huge goiter and hypothyroidism as a result of it. So in all these cases, the baby suffers the most.
Yes.
Not compared to the mother suffers much less.
Okay.
So in this way, for the baby itself, please treat your thyroid disease.
Just take a medication on time and keep a check on lifestyle changes. So thank you so much for joining us, and I'm sure after this episode, our viewers must have got a lot of clarity about thyroid and how it can be treated during pregnancy. So thanks a lot for answering each and every question patiently.
थैंक यू।
तो दोस्तों, आज के एपिसोड में हमने बात की थायराइड और प्रेगनेंसी के कनेक्शन के बारे में। एक ऐसी हेल्थ जर्नी जिसके बारे में अवेयरनेस होना बहुत ही ज्यादा इम्पोर्टेंट है। तो अगर आप एक्सपेक्टिंग हो या फिर अगर बेबी प्लान कर रहे हो, तो इट इज वेरी इंपॉर्टेंट फॉर यू टू अंडरस्टैंड दैट थायराइड लेवल्स का मेंटेन होना इम्पोर्टेंट है, जस्ट नॉट फॉर यू बट फॉर योर बेबी एज वेल। सो इफ यू फाइंड आवर वीडियोज इन्फॉर्मेटिव, डोंट फॉरगेट टू सब्सक्राइब टू आवर चैनल and follow us on Instagram at Mankind Specialities for more such informative videos on various health topics. Until then, stay informed, stay healthy.